Welcome to the DIL podcast, Digital Health Innovations for Long Life. It's an absolute pleasure to have you, Professor Sasahara, for our podcast. Perhaps this is a time where I'll also have to mention that I got interested in health informatics listening to your lecture in Temple University, and that was long time ago. I think about 2008 or 2009, perhaps. And that is the first time I heard the word health informatics and started looking into it, and even changed my PhD topic, and then began my long journey in health informatics, which changed its name to Big Data for Health, and now it's popular by the name Digital Health. You also kind of had a very long journey in digitization, especially in your area of security. So, if you can please tell us all the time when it was actually started, when you are born, where you are born, we can perhaps start from there the discussion.
Yes, I was born in Miyazaki Prefecture in Kyushu Island, and yes, and maybe since 2008, I've been a representative of the Japanese chapter of the Cloud Security Alliance. Still now, yeah.
Yes, sir. When were you born, sir? The year, if I may ask.
Pardon?
The year when you are born.
Uh, 1961.
Okay. So you are born in Miyazaki Prefecture in 1961.
Yes.
And then where did you go to school, sir?
Uh, undergraduate, I studied at Keio University.
Okay.
Yes.
So you studied undergrad in which subject?
I majored in industrial relations, and my thesis is for the Honda motor
Okay.
manufacturing. Yes.
Okay. And then you did your master's and PhD whereabouts?
Yes. I took a MBA at the Boston University in the U.S. in 1996. Yeah.
Okay. Okay. And I believe you did PhD also.
I I got PhD at Chiba University in south of Tokyo in Japan. Yeah.
Okay. Well, I've also lived near Chiba actually, and I've been to Keio University, not to Boston though, but I think I've probably been to both the places that you did your bachelor's and PhD also. So I think we met sometime in 2009, I believe.
Yes, exactly.
Yes. And what was your first job, sir, if I may ask?
So my first job was the Minister of Labor, the Japanese government.
Okay. And what was it about?
Yeah. So not so exciting. Yeah.
Okay.
So bureaucrat. Yeah.
Oh, okay. Well, it's a very important job, except that it feels a little bit boring, I guess. And then if we can discuss about your career, how it progressed, maybe a few transitions in your career, if you can mention, that would be very helpful.
So in that means I have working experience with both Japanese, typical Japanese organization and non-Japanese organization both. Yeah.
Mm-hmm.
And in addition, originally I went to Boston University to study business management in general management at first.
Mm-hmm.
But in Boston I found that even physicians are studying MBA to get to manage hospital organization, management of hospital organization. And I found that there I saw the so-called healthcare management, including healthcare IT. There I studied healthcare IT too. Yeah.
Okay. And you also play an important role in the Japanese American Chamber of Commerce, I believe.
Yes, of course. And I I work for the IBC, so the U.S. Research firm, based and there I learned this typical U.S. style management and research method.
Okay. So you studied healthcare IT first time in Boston. When was it? I mean, like, if you can put a year to that, that would be really helpful.
Oh, this is kind of good year because 1995.
Okay, that's. I mean, I was still in college. I think I joined college in 1994, so that's just 1 year afterwards. Uh, Now digital health is fairly an accepted topic, and now it's also an expanding topic. What, in your opinion, is the vision of digital health? How do you see digital health now into the future?
Yeah, currently, particularly in Japan, so digital health, the field of digital health was strongly linked with the traditional medicine or medical device or pharma, pharmaceuticals. However, now, particularly in the U.S., so many people are focusing on prevention.
Yes.
And yes, so from perspective of prevention, so even so, American researchers are newcomer, and I think it means. On the other hand, so I visited India several times, and from the very beginning, so digital health in India has focused on prevention because of lack of human resources and natural resources in the Indian market. So.
Yes. Everyone says prevention is better than cure, but unfortunately, there is no fixed steps or perhaps like a implementable program for prevention. How do you think digital health can help prevention and perhaps like make the healthcare better for everyone, Professor?
So by using digital health technologies, so we can get a variety of health data continuously, and
That's right.
so from those and now, particularly now, so those data are becoming an asset,
Yes.
and to analyze the future.
Japanese population is known to have a fairly longer life expectancy than others, where it is fairly common to see people in Japan living in their 90s, hundreds, and even crossing hundreds. How is digital health being used in the Japanese population or in the Japanese health system?
So particularly and now Japanese elderly people are depends on the nursing care within the facilities. However, due to economic situation of healthcare insurance, more and more people are moving to that home-based care, and
And
this is,
Japanese people are also known to visit doctors regularly. Is that true? I mean, on an average, Japanese people relatively visit their doctors at least once in a year or even more frequently, once in a quarter.
so it is case by case. Yes.
Okay. Or maybe is it because they all live longer, they tend to visit healthcare physicians a bit more?
Yeah. But so now it's not, so now uh, I'm taking physical exercise with elderly people in my community, and
Okay.
so maybe also they are 18, 80s or 90s, so
Okay.
very aggressive. Yeah.
Yes, there is a lot of community activities that are conducted or offered to elderly people or perhaps like even people in their middle ages in Japan. How common is that? Is there a lot of community activities? What kind of community activities do you do?
Yes, mainly. So I'm doing physical exercises because and some of them are adapting yoga. Yeah, from India, and yes, it's very and some of them are attaching wearable device.
Okay.
Yeah.
Is that common? What kind of indicators or data points do wearable devices measure?
So it is just they are walking every day,
Okay.
and so how long are they walking distance or something, and also the heart, heart and blood pressure, something like that.
From your point of view, I mean, are there any new wearable devices that are coming to the market which will measure more and more parameters?
Exactly, yes.
Yeah. What kind of devices will be coming to the market?
Yes, of course, also specialty devices are also coming, but many people are utilizing the smartphone. Smartphone, particularly smartphone, because smartphone is very many particularly elderly people are now accept smartphones, and they can do something with them.
Yeah, can you expand on the smart home, and also you mentioned home-based healthcare. Can you expand on what kind of services are being offered under smart home and home-based healthcare?
Yes, and yes, in many cases, application software was installed on the smartphone, and by utilizing this application, so elderly people can control the features of devices, wearable devices,
Okay. And your focus is on security issues. I mean, essentially the security and confidentiality of data. So, in healthcare, how relevant is security, and can you please expand on the security and confidentiality of data in healthcare?
Yes, in particular, for example, so in Japan, so aging people are also target of the crime.
Yes.
And yes, and the attackers are looking for personal information to get attack. So in this means now elderly people are very sensitive to their own privacy, personal information.
How can we prevent that? Is there a way to prevent these security hacks?
Many and so they use connection service to the police, and also the kind of detect and prevention features, also the phone or mailing, so, and they are checking those features every day.
Yeah. You have been to India several times. How do you think India and Japan can collaborate in digital health?
Yes, at first I've been to Hyderabad in 2018.
Yeah.
Yes, and last year I've been to Hyderabad too, and just before a bit before and after COVID-19, so situations are very changing, particularly in India. I found that
So how can we collaborate? I mean, in what areas can we collaborate?
particularly I say that in prevention.
Okay. Well, I think we can perhaps collaborate in designing wearable devices, as you mentioned, and I think collating data and then see how it can actually benefit the elderly people. I mean, there are more and more people becoming older in India also. I think that's some area that India and Japan can jointly collaborate.
Yes, and particularly in Japan, so, the people in 80s and 90s are very much. And currently, the average age of the in India is 70 years old or 8?
Yes, the average presently is about 72, I guess.
So in Japan, more than 80 people data was already gathered, and so maybe those data you maybe can use you. I think that Indian researchers can utilize those data.
Okay. We have now kind of covered several areas. I mean, one is on wearable devices, home-based healthcare, security in healthcare. How do we teach all these topics to students? Is there a specific way, or in your opinion, how can we teach all these ideas to the new students? We are actually starting India's first school of digital health, and in fact, like we are talking to several experts like you through this podcast to understand what are all the areas that we need to focus on and how can we bring all those things into the curriculum. So, in your opinion, how can we teach all these ideas to students, Professor?
So, regarding the data test, so-called by design is a keyword. So, security by design, privacy by design, quality by design. So, maybe I would say so it could be better to teach security courses in the beginning of the design processes, because designers and developers are responsible for the products.
Okay. When you mentioned design, how do we approach it? I mean, are we going to bring all the stakeholders together, or is there any specific steps that we can take to bring design first into development? In fact, even we also want to propose or focus on design-led digital transformation. So, how do we bring design first, Professor?
So at the design process, engagement of particularly for the patients and or consumers are essential, because their needs will identify special features or special topic for the designers.
In your opinion, are there any Japanese companies that we can perhaps are doing great work in digital health that we can also look up to and see if we can learn from them?
Yes, I would say particularly I'm very interested in the automotive industry, because automotive companies are moving to the digital health market now, and they're focusing so-called health and well-being solutions, and so maybe Honda or Toyota, they are now entering the market. So I hope that particularly collaboration with those newcomers in the digital health industry would be a good opportunities.
So you are mentioning about the automotive industry. Can you please repeat that part, please?
Yes, Japanese automotive manufacturers such as Toyota and Honda, so they are very interested in entering so-called health and well-being market. This also means also preventive health, yes. And so entering also those newcomers are very important thing for particularly traditional healthcare, pharmaceutical and medtech industry.
Okay. I believe Toyota is also setting up a new city also. It's called as Owen City, with focus on longevity and continuous care. And most of Japanese automotive companies are also investing heavily into drone-based mobility. How do you think drones can actually help in healthcare, Professor?
So regarding drone, so drone is linked with supply chain,
Yeah.
and so particularly So in case of automotive industry, so just in time is a keyword, and also so
Yes.
just in time delivery is also essential for the using utilization of drone.
So you believe drones can help in just-in-time delivery for healthcare?
Yes.
Okay. Again, the question is, how do we teach drone technology to students? Uh, Drone technology, especially in healthcare use to students.
So I think that's also so drone is a part of IoT, Internet of Things,
Okay.
and so maybe so in the field of, from the technology perspective, so drone is a part of IoT, and also so maybe so students can recognize maybe IoT as a whole, and specific parts of IoT for for the healthcare delivery is one role of drone.
Okay. Well, I think we have discussed several topics, including wearable devices, home-based healthcare, and then design and also mobility with regard to drones also. Well, thanks a lot for sharing a lot of your thoughts, Professor. I think